Welcome back. Now, the Ghana Health Service has stepped up public education on the safety of the COVID-19 vaccines expected to arrive in the country this week. The Ghana Health Service has confirmed it will take delivery of more than 500,000 vaccines for the vaccination. So far, the Oxford-made AstraZeneca and Russian-made Sputnik V vaccines have been approved for the inoculations here in Ghana. Even though the Ghana Health Service has been assuring of the safety of these jabs for use in the country, Ghanaians are divided as to whether or not to receive them. We'll hear shortly from some of them on some of the things that you've been telling us. But first, listen to the Director of Public Health at the Ghana Health Service, Dr. Franklin Asiedu-Bequin, giving details on these vaccines earlier on the Super Morning Show today.
So, Ghana has signed the indemnity clause for the COVAX facility. If you look at the Sputnik, it is not part of the COVAX facility. So Ghana is there to sign that arrangement with the present government. Apparently, if you look at the ministry or the president, he wants us to be dealing directly with the source. So in terms of like AstraZeneca, we actually signed a contract with the Serum Institute of India. So for Sputnik 5 or B, as we talked about, we are yet to get that arrangement done. As I said, we had the signing or the approval done a few days ago, and the government is going to engage the Russian government in that perspective. But as was said by Miao, we are not limiting ourselves to particular vaccines. If you want 40 million doses, then you need to up your game, either treat more cold rooms or making sure that you get available vaccines. So we are not restricted in terms of the kind of vaccine. So far as the state, the cost is not an issue for us to get the 40 million doses.
Are there any hidden advantages of the fact that on this occasion we are buying from a nation rather than a pharmaceutical company in terms of price and perhaps even diplomatic arrangements to get more or get them quicker? Are those options available to us?
Well, I think that if you look at the Sputnik 5 or V, it's from the Gamaleya Research Institute, which is under the Ministry of Health. So it's directly a government entity. The other products are private oriented. So I don't think it's much of a difference. The issue is we are trying to go to the source of production so that I have that government to source arrangement.
That's Dr. Asiedu-Bequin there. Now, the public is divided over whether or not to receive the jabs when they arrive. We put up a post earlier on our social media handles. Let's take a pic of your responses. So we'll ask you whether or not, to what extent you are happy to go for the jab. This one says, local journalist says, I won't unless 6 to 12 months time when I'm comfortable with the side effect of those who will be vaccinating early. Buyer Jeremiah says, yes, I'm ever ready, any day, anytime. Ghana has good track record when it comes to vaccination and immunization, and I'm ready to be the first person to receive the vaccines, even live on the public. This one too shall pass. Frank Hossel says, when money foodstuffs are being shared, they share it among themselves. All in the name of NPP, they should share the vaccine among themselves. All in the name of NPP. Estino Klucher says, I learned every country is developing its vaccine because it seems the virus is working, or the virus working varies from country to country. If this info is true, then I think the government of Ghana should arise to the task of manufacturing its own vaccine. Clement Amibe says, I think I would take it, but we need to educate the general public more about what happened in South Africa with regards to the drug not meeting its target and some of the side effects of it if someone has been vaccinated. Thank you. Atama Enchi Anthony says, to be sincere, without hiding any thoughts in my mind and without lies, to the actual truth in my clear, open mind and clean heart, expressing whatever is embedded inside me for a long time, which I didn't say, just because I was nervous. But today, by gathering all the courage and motivation, I just want to say that I actually have nothing to say. Seriously, Atama Enchi Anthony there. All right. Hopefully we'll be able to educate as many people as possible.